Thank you so much for being here, everybody. Thank you. I feel so much love and so much gratitude. But before we start, I want to just bring in gratitude for everyone who is present right now. Gratitude for our beautiful physical bodies. Let's give ourselves a little, hand rub to hand rub. It's, palm to palm. Feel your hands against each other. I often do this exercise to remind myself of what a miracle it is to have hands and fingers and a body to house our spiritual beings that are having this human experience. And so just giving thanks to these intelligent forms that we're embodying and so wise and so healing. So thank you so much for being here. I hope you're thanking your beautiful bodies for this too. Shout out to Rachel Varney, who led our Body Next Tier Facilitator Gathering, which is a free event that we put together every month for facilitators in the community. And we have a speaker who comes forward every month and they share their wisdom, their experience with the whole community for us to hold each other in integrity. So that's one of the things we do in Conscious Physician. And Next Tier Facilitator was a collaboration between Conscious Physician and TAP Integration, which is an AI tool helping facilitators and individuals post journey. And this is a program developed by Olivia McDonnell. She's a sister, just an amazing human. Look her up on LinkedIn. She's all over. And we are collaborating to bring this technology forward to those who are going to participate in our program starting in January, which we'll get into shortly. So today, my friends, we are going to take a look at policy and medicine, as a lot is changing all the time regards to psychedelics and the realities of clinical practice. We're going to hit the foundations and the framework of what we have that we're seeing currently at the national level and at the local level. We're going to look at what is hype right now and what is real in psychedelic care. We're going to look at the safety and ethical framework for clinicians. We're going to touch base on these things, not in depth, but touch base on it. What Conscious Physicians Psychedelics Academy is and isn't. I know a lot of you have heard about it by now. Some names that I'm seeing up here, you're already members. Yes, I'm so excited for this cohort starting in January. All right, so take a deep breath, my friends. Let's take a deep breath together. Just 20 seconds of today. Let's give that to ourselves to really ground into our physical form and feel ourselves in this moment in time. Breath in, hold at the top. Feel your body, feel the discomfort of even holding the breath, and then let it out audibly. And feel free to do this as I'm presenting to you, of course. All right, what are we looking at in New Mexico, you guys? So this is a picture that was taken in one of the advisory board member meetups. It was right before the advisory board members were announced. Here we are. This is me. This is Dr. Larry Lehman, who's a big time researcher out of UNM. He is globally known for his incredible work, especially in postpartum women with addiction and PTSD. Let's see, Amy Wong, who's a big deal in our state as well. Senator Jeff Steinborn is right here. And Dominic Zerlo, who is just an amazing human. He's the executive director for cannabis and psilocybin now. And some incredible individuals on the screen. I didn't capture everybody because, there was like 3 pages or 4 pages of people on this call and other calls that we've had so far. So now we do have an advisory board member of 7 individuals who the Department of Health and the state went through process of selection. And now we have the 7 advisory board members. Department of Health wants to expedite the release of rules and regulations to 2026. The bill states that we need to have all of this sorted by end of 2027. So really beginning of 2028. That's what the bill says, the Psilocybin Medical Act. And if you want to look it up under SB 219, the Senate Bill 219, and the individual responsible for sponsorship is Senator Jeff Steinborn. This is a historical moment. The Psilocybin Medical Act of New Mexico is a framework that has not been demonstrated anywhere else in the nation. What was really cool about it in April and March, when we were all super excited and connected with each other, we kept this momentum going in the grassroots. We had a big showing of professionals, of veterans who have gained healing utilizing psilocybin and other modalities of therapy and psychedelics, who all came to the forefront at the Senate Judiciary Committee. That's where I had the privilege of testifying in. It was at the end of March, or maybe mid-March. Senator Steinborn was the one who really brought us all together, and it was phenomenal. All these people that you see on the screen and many more were involved in bringing voices and stories and mission and vision to bring life to this movement. What's so cool is that we went through a regular, traditional legislative process, unlike any other state that has done it so far. And the two states that have been very successful so far have been Oregon and Colorado. And I'll talk about Texas as well. Texas also passed their ibogaine bill. If you don't know, look that up as well. And we are collaborating there together to bring our training, our certification training for facilitators to also the state of Texas, to help them have a robust and safe, with high integrity program that is led by physicians and for clinicians and healthcare practitioners in the community. But it's been a really cool movement seeing these states really light up. But another thing that sets New Mexico apart is that we didn't spend any money on this. We spent human time and energy and expertise on this, and really creating a movement in the community to pass this as a bill and take it to Governor Lujan's desk in April, which got signed. Thankfully, we're so grateful. We're so grateful. The other states spent millions of dollars, upwards of $50 million. That's a lot, and happy that it's gone through. But then there's many states like Michigan, Massachusetts, and which spent a lot of money, but it didn't go anywhere. So the power of people here and power of community when we believe in something. And this bill, I was called in to review our New Mexico bill in 2023 as well. And back then, there was a lot of loopholes, and I just didn't feel that I could really get behind it. And many of us felt the same way. It wasn't as robust. So if you have questions, you're from a state that is looking to change their bill or law, reach out. Happy to connect you with the right people. The bill draft matters a lot. Safety matters a lot. There has to be layers of understanding of what we're doing here and how we are implementing it into the community. So, as I mentioned earlier, the state bill timeline in the bill says by 2028, let's figure this out. Now, the Department of Health, because we're seeing such incredible need in the state of New Mexico for ancient and innovative modalities of healing for mental health. Let me give you some statistics to have an idea of what we're dealing with in New Mexico. We are top 3 in suicide rates across the country, and year after year. Top 3 in poverty year after year in the United States. We are number 1 by twofold in alcohol use disorder. And I see this all the time in my patient population. I saw that as a hospitalist. I see that as a hospice physician. Young people are dying because of alcohol every day. Young as in 19-year-olds, as in 22-year-olds. So it's a really sad state of affairs. UNM came out with an incredibly robust study a couple of years ago by Dr. Snehal, who is part of Department of Psychiatry at UNM, showing 80% remission rate when utilizing psilocybin macrodosing in conjunction with robust psychotherapy beforehand, robust psychotherapy afterwards, and a guided session in the middle with a high dose psilocybin. 80% remission rate. I cannot, as a physician, give you any medication that would help people stay off of alcohol 80% and over a long period of time. So to me, it's a super exciting time for our state and for other states. I mean, globally, this is a very exciting time. And we do realize that we are pioneering this work for the rest of the country as well. We have had Conscious Physician has had a very direct participation at the state level as an advisor to the state legislators. It's just so, it's such a privilege to be part of this movement. And why does this conversation matters right now? I gave you a picture of what we're dealing with in New Mexico, and a lot of it has to do with intergenerational trauma that we have not been able to help people with, guide them. Hey, there are tools so that they can guide themselves in their own healing. We are here to provide agency back to people. Say, you can. You can breathe on your own at home instead of go to the alcohol because you need to dampen your anxiety, or it's just too much. That panic feeling of panic is too much. You can go outside and walk for 10 minutes to emotionally regulate yourself, not to run away from your problems. You can. Every individual can. We're here to help them see that and connect with their inner guide. And looking at some statistics, about half of US healthcare workers and nearly half of physicians report burnout right now. This is all cited. And right now, and I think that statistics is a lot more. When I was looking at human and health services statistics, this is about 6 months ago I was looking at it, and across all professions, we are looking at about 60% and above in burnout rate. What are we doing that is not in congruence with humanness? I want you to think about that. That's a big statistics of unhappiness and dismay in our world right now. More than half of therapists, including social workers and psychologists, say they've burnt out in the past year. Huge, right? We see that this uprise also during COVID, because it was just so much human suffering. And then as therapists, as physicians, as nurses, we didn't have tools. We still don't know tools to utilize to know how to examine ourselves. And then roughly about 1 in 6 people in the US meet criteria for substance use disorder. And about 1 in 5 adults have an anxiety disorder in any given year. And I think those are underestimations, but this is what I could find to really educate that we are in a place that we need better. We need innovative methods. We also have ancient methods that we need to integrate. We have indigenous ways that have been shown over millennia that works, and we haven't tapped into it. We just need to remember. And then really looking at the planetary effects of us being burnt out, of us being so anxious, of us being so depressed. The planet suffers. Suicide remains near historic heights. And across population, and then in the veteran population, is 1.7 times higher. 20 to 30 veterans a day commit suicide, which is a sobering number. And I'm mentioning all of this because this is also all part of our policy in New Mexico. It's part of the bills, and we'll get there. Among patients with advanced or terminal cancer, roughly 1/3 have a mood disorder, and 15 to 25% have demoralization, saying, I don't have a reason to go on. And about 20% report some wish to hasten death. And we can do something about it, is why I bring this up. It's not to make you depressed. It's about, hey, this exists in our reality, and we can do something about it. And patients And communities already talking about psychedelics, you guys. You look at any media, any news. And when my parents send me articles from the New York Times, the Washington Post about psychedelics, because they know I'm passionate about this work, the older population is like, they know about it. So it is absolutely happening, and people are seeking better ways of healing. And also, misinformation is everywhere, both fear riddled and stigma riddled, and also a lot of hype. Like, it is not that you take this magic pill and everything becomes fine. In fact, things can disintegrate when you take that magic pill, and then you have to reintegrate yourself back into life. And so, as clinicians, you may be, on this call, you're a clinician, you may be a licensed professional, you may not have a license, you may be a community healer, you may be already facilitating kind of under the ground and you're doing your thing, you're healing people, you see the power of the medicine, and you want to learn a bit more, and you want to have evidence informed, ethically grounded approach to the work that you're doing. And education protects patients, clinicians, and communities. More education is always better, in my mind, always. And I see it when it translates into practice. And as clinicians, right? As you know, I showed you the burnout rates in my own profession as a physician, as therapists, as nurses, NPs, PAs, social workers, you name it, counselors, lawyers. We all face burnout. And I'm saying it because I was part of this statistic until I dug really deep and I worked really hard on myself trying to figure it out. And is it all gone? No. I still face at times, I'm pushing myself too much. I'll get a migraine here and there, and it's not fun, but I know now how to approach it so that I don't get to that place of burnout where I cannot go on anymore. No one wants to be there. And we also have this pressure of being the expert without having the formal training. So when a patient comes to your office and is saying, "Hey, I heard psilocybin is going to help my depression because I got this cancer diagnosis. Can you tell me more about it?" If as a clinician I have nothing to tell them, it kind of feels like I'm lacking. And of course, this is not a part of anybody's education right now. And this is the gap we're trying to close with the Conscious Physician Psychedelics Academy. And people have a fear of being reckless or misinformed. We all are ethical people. We want to do good in this world, and we don't want to misinform. But we might have, had an article that's a hypey one that says, "Oh, take this and you're going to be just fine. It's a magic potion." And then we have one that's saying, "Be very scared of it and never go towards these. You're going to be addicted." In fact, psilocybin has been shown over and over again that it's not addictive. So it's important for us to have grounded learning and a trustworthy community to turn to for these questions. Many of you who are on this webinar know me already, but for those of you who are new, I'm Dr. Lida Fatemi. I'm at heart truly a family person. I'm just a human here listening to what the universe is telling me to do and giving me the capabilities to do. And I'm so thankful for being a true channel of this work. I love being a mom. I love being a pet owner. We have a little bunny now that you might have seen on social media. I'm an educator. I love being educated, and I love learning, and I love educating so that it's a two-way street. I did create the conscious physician method out of my own burnout and then desire to not only survive but to also thrive. I've had the privilege of being on ABC, NBC, on WebMD, Roku. I'm also a doctor of osteopathy, which I really love because it connects me with the human touch. We learn osteopathic manipulative medicine. For those of you who are DOs on this call, Dr. Cox, Dr. Michelle is here. We went to medical school together and learned OMM, and it's such empowering work to be able to have this with your hands so you can relieve suffering. And I have a degree in Master's in Public Health from Emory University. CDC was on campus when still is on campus. But I got trained with some globally known individuals, and I learned so much about the realities of public health, of population health, and where we can go wrong with it and where we can go right with it. And this is why I'm doing this work. It's informed so much of the work that I do. So, the work that we do in Conscious Physician Psychedelics Academy, I know a lot of you are here for that. It's a physician led 9-month program. It's for healthcare professionals, whoever is patient touching. I have death doulas who are really interested in this, and you're absolutely welcome to the cohort. I also have physicians, MPs, PAs, therapists, first responders. And what we do in this program is that we are blending trauma-informed psychedelic education. Because as we know, trauma, unresolved trauma, we all have trauma. And from childhood, maybe even now, we have trauma in our realm of whatever we're part of. But understanding how I can examine it, or how I can examine my triggers so I don't go back into that programming of fight or flight, and a nervous system that is calm and relaxed so I can move on through life with ease. That's really central to psychedelic education. Because in psychedelic realms, sure, maybe you're not feeling that pain anymore and you're able to see where your suffering is coming from. But it's also really important to be able to integrate that, what you learn in those psychedelic states, into life, as we know. So we're also teaching about evidence-based conscious life practices. These are integration methods grounded in science, safety, ethics, and deep integration. We actually have an entire group of people who are going to teach us about integrations through tap integration, through Olivia McDonald and her partner Susan, who are going to help us navigate these waters with more breadth and wisdom. What is our mission here? Our mission is truly to heal the clinician. And if you're a first responder here listening in, if you are a death doula, if you're a doctor, if you are a nurse, you're a nurse practitioner, physical therapist, if you are really touching any patients, we're here to help you heal first. I was there, you guys. This is all from my personal inner experience. When I was burnt out, you didn't want to be around me. I was prickly as a person in my family system, in my community, with my patients. I still had the biggest patience with my patients, because that's what we learned. That's a deep programming of also people pleasing. But when it came down, got closer and closer, closer to my own nucleus of the human being, I was the most unkind to myself. And my deep trauma came because of living in war, because of the unkindness of a government that I lived under that's a terrorist regime, still exists, that made me feel bad about who I am as a child and as a female, that told me my needs did not matter and that people pleasing was the way out, was the way to calm everybody else down so that I would be not harmed and my family would not be harmed. Censorship, not using my voice, was huge in this trauma. That's something I'm still working on. This webinar is a part of this. But healing is a journey. Healing is every day. It's not one and done. We get to a place where the heavy stuff is gone so we can thrive. But when we're thriving, we're still healing little by little. So healing the clinician is at the heart of our mission with Conscious Physician Psychedelics Academy. And the 9-month course is based on that. Healing the community comes after, always. If we've healed the clinician as influencers in our community, that ripple effect goes out into the community and we heal the community regardless. We're also here to help evolve medicine responsibly as it is determined by policy, by the New Mexico Psilocybin Medical Act. We know that the legislators and the people who put this together, thank you so much for doing this, and the advisory board are very much in tune with doing this responsibly and safely. So we will be very much in communication with them about this. And so we have the 9-month gestation model for 3 trimesters. So that's paced, it's supported, and it's real. There is learning, there's practicing, there's integration, there's embodiment. And then when the healing of the clinician has come to a place where you feel good and more complete, layers have gone, then you can step into your community and create your own program. We even included business coaching in our program, you guys. There's business coaching, there is tax coaching, so that in this new realm of psychedelic service industry, because I have a lot of people on this call that I know who are trying to step away from what they were doing previously into creating their own practice as a facilitator. How do we do that lawfully? How do we do that business savvily? So we have all those pieces for you all as well. Now, at the federal level, I'm going to pause here and talk about federal policy. As promised, federal policy is a really cool place right now. There is absolutely light at the end of the tunnel. So per the Controlled Substance Act of 1970, psilocybin was a Schedule 1, which means it has no therapeutic benefit, and it's illegal. It's an illegal substance without a therapeutic benefit. As we all know, we have much research to show. In fact, upwards of 3,000 research articles that have been published on PubMed showing the significant benefit of psilocybin in individuals across with different, indications with depression, treatment-resistant depression, anxiety, OCD, PTSD, alcohol use disorder, end-of-life anxiety, you name it. And that's been the rhetoric until now. We have one of our guest faculty, Catherine Tucker, JD, who is based out of Oregon. Her and Dr. Sunil Agarwal, they got together, and Dr. Agarwal is a palliative doctor in Oregon, and decided that I want to be able to prescribe psilocybin for my end-of-life patients. And I can't legally at the federal level. So they sued the DEA together. And this is what's happening right now. This was a couple years ago. And now what we're seeing, when you see on the news that the FDA and the DEA are looking to reschedule psilocybin to a Schedule 2, it's them. Catherine Tucker is one of our guest faculty on the program to make sure that we all understand what is happening. And we have some incredible other guest faculty as well that we're super excited for. But shout out to Catherine, shout out to Dr. Sunil Agarwal. Thank you for doing the work that you're doing. And so the first trimester, you guys, we're going to go into foundations. We're going to talk about safety ethics. We're also going to drop into self-care methods. We're going to really understand what integrity means in this space. We have some incredible faculty who are going to come and talk about psychedelics, of course, but what can we do to get to those expanded states without psychedelics? Thermal therapy is one of those. Cold and heat therapy is one of those. Meditation is a big one. Holotropic breath work is a big one. Somatic therapy is a big one. When integrated with psychedelics at little tiny doses and also really big doses, all of these different tools, they blossom into something unbelievably incredible. I've seen so much transformation happen in individuals at the end of life when they have a cancer diagnosis. I had a patient at the age of 44 with a 6-year-old son, a physician mom, who came to me with severe anxiety because she was dying with pancreatic cancer, had gone through all the treatments and Whipple procedure because of her pancreatic cancer, and for 2 years, clinical trials and you name it. She was at the point of break, and she had so much anxiety. They had just found new lung nodules, and she was given 3 months to live. They said you'd no longer qualify for any more treatments or surgical interventions. Her albumin was too low. She was getting IV hydration at the hospital every 3 days. So twice a week, she was getting IV hydration. She could barely keep anything down food wise. Well, she enrolled in the program because she really wanted the anxiety gone, because she couldn't connect with her family anymore. When I met her, she was shut down in her master bedroom, no light coming in. She was crying all day. And I would tell her, I'm like, what are you doing? What's happening? And she was like, I can't talk to my family because it's just too painful. I don't want to leave my child behind. I don't want my parents to have to bury their child. My husband is grieving himself. What do I do? And she felt really guilty because she was a person of faith. She was a Christian, and she had a really hard time reconciling, why am I so afraid of death when I'm such a devout Christian? Well, we started working together. We got into these self-care methods. She was a pathologist. I knew as a pathologist and as a physician mom, she had no self-care methods. So we started doing them first. So we practiced meditation without any medicine. And she started, her albumin went up. Her hydration therapy no longer needed IV therapy. She qualified, you guys. She qualified for a clinical trial at stage 4 pancreatic cancer. She qualified for an MD Anderson clinical trial again. She lived for another 12 months. And what was so amazing about those 12 months that she lived was that she was not locked into her master bedroom anymore. She was outside in the sun with her son playing Pikachu because doctor's orders, right? Nature therapy was part of our program. Sun therapy was part of our program. Eating higher protein diet was part of our program. She increased her albumin. She qualified for clinical trial. We added a little bit of psilocybin, very small amount, 5 to 10 milligrams once a week. She felt completely different. She could hang out with her husband. They ended up, one of her bucket list items, which I'm so proud we could get her there, was to make beaded bracelets and sell them at the local farmers market. So they did. Her and her husband had a booth. She sent me pictures. She got to see her child's 7th birthday. So the power of these medicines are very incredible, especially when we have the proper tools. That's why our program is 9 months. Our program really gets deep into tools that you get to utilize in your own life, and you get to educate your community about, to uplift them, to help them transform, to help them not only survive, but to also thrive. And then the second trimester in our program, we have the ceremony. It's probably going to be 3 days. We're trying to figure out logistics still. I was looking at other countries such as Mexico and Costa Rica. I don't want people to have to spend $500 to $700 just for a ticket. So I'm trying to make it cost effective. We may be looking at Colorado spaces where we're under legal umbrellas. And this program is non-medicine touching. So there are other people in the community who will be helping us with the medicine part of it. That's more to come. We're staying completely legal under the federal law and under the state law. And if you have questions about that, let me know. Oh, the last trimester is going to be a thesis. It's going to be about your professional identity. Let's develop that. Let's bring you out completely as a healer, and so that you can uplift your community. That's the last trimester. So this is a bit of a reiteration of what we will cover. We are also covering all the major psychedelics, psilocybin, MDMA, ibogaine. We're going to look at legal psychedelics as well, such as Amanita muscaria, canna. Cannabis is a huge one that we don't talk about, especially for end-of-life patients. So all of that, we have experts coming on board as guest faculty to teach us about all of it. So we were able to get CME accreditation through University of New Mexico School of Medicine. I mean, I cannot tell you how excited we are about this designation. This is AMA PRA credit, 1 credit per hour that we're giving to our physicians. This is huge. This is how we create movements in the physician community, taking away the stigma, teaching about the integrity, teaching about indications, contraindications, just like any other medicine that we should know about, such as opioids. There are indications and there are contraindications, and there's safe usage of them, and any antibiotics even, right? So this is so huge, and the entire program, if the physician who's enrolled, they finish every single hour that we're together, they can get 35 credit AMA, PRA, 1 credit hour per each hour that they attend, for a total of 35 credit hours during the 9-month course. So if you have institutions who would pay partially, they would reimburse you for this, which is fantastic. We are also working on CEU for psychologists, because we have a psychologist who's onboarding right now, and we want to make sure we honor their, their education as well. And so it's super exciting, super exciting. Also, as I mentioned to you all, this is a collaborative effort with us and the state of Texas through TAP Integration and Olivia McDonald and her team, which is an AI integration tool. We also recognize that as facilitators, people can get very burnt out at the facilitators when you're facilitating. And if you're not handing off the person to somebody else, if you're following your person afterwards too, they need daily prompts. They need daily attention. Some people do and some people don't, but a lot of people do, especially if it's their first time or if they had a difficult and challenging journey. They need that tight container before and after. So the TAP integration is really lovely because it works with people's integration with voice. So you're telling the prompt what's going on, and it picks up on your intonations, and it picks up on what is happening psychologically with you, and it gives you the material you need. And it's about 3 minutes a day. So that's a fantastic tool to be able to utilize as a facilitator. So you're not the one burning out. You have a tool at your fingertips that you can give your clients, and it's also they have agency and 100% personalization, which we are very excited for. And as far as I know, I have to go back to this, you guys. We are one of 3 programs, I want to say, per research that I've done, that provide CME hours, continuing medical education hours, to physicians. EUs are out there for psychologists and social workers and therapists and counselors, but not CME. So really proud of that. And also the integration of AI we are absolute pioneers in this. So these are some of our faculty, and I'm going to pause at our faculty. I don't have all of their credentials ahead, in front of their names, but everybody's just a superstar on this team. Zach Leary is Timothy Leary's son, who's just a humble human with a ton of knowledge and wisdom about the world of psychedelics, because he was exposed to it since birth. And Catherine Tucker, as I mentioned, she's at the federal level moving things along for end-of-life patients and psilocybin rescheduling to a Schedule 2. Dr. Maya Armstrong, Dr. Larry Lehman. Again, these are volunteer guest faculty. They are not getting compensated. They are guest speakers with us, and they're doing this from the good of their heart so that they can help us transform and heal the clinicians so we can heal our communities. Next week, on December 17th at 12 p.m. Mountain Time, I'm holding another one for those who missed it. And the replay is available as well for today. Love you guys. Thank you, thank you, thank you.